everyone, this is MBBS Gallery. Today our topic is typical intercostal nerve. It is one of the most important university questions. A little more confusing, but this is a precise note which help you to understand and memorize easily. So typical intercostal nerve. These are from this we come to know that intercostal muscles are supplied by these nerves. So the introduction is the typical intercostal nerves are those that remain confined to their own intercostal spaces. So the typical intercostal nerves are third, fourth, fifth, and sixth. Third to sixth intercostal nerves. So confined to their own intercostal space. So this is the introductions and course and relations. The typical intercostal nerve, after its origin, turns laterally behind the sympathetic trunk and then enters the intercostal space behind the parietal pleura and posterior intercostal membranes. It then enters the costal groove of the corresponding ribs to course laterally and forwards. In the costal groove, it comes into relation with the corresponding intercostal vessels and forms the neurovascular bundles of the intercostal space. What is neurovascular bundle? Here see a diagram. This is a neurovascular bundle. It consists of a structure from vein structure, vein, arteries and nerve. This is they are saying. So in the intercostal space, vein, artery and nerve lies in that order from above downwards. So near the sternal end of the intercostal space, the intercostal nerve crosses in front of the internal thoracic artery. This is internal thoracic artery, important point. Then it pierces the internal intercostal muscle, anterior intercostal membrane and pectoralis major muscle to terminate as the anterior cutaneous nerve. Let us see few more branches. So this is the diagram. Here we can see the rami commitants, and there's a pleural branch, and here the lateral cutaneous branch, and here the anterior cutaneous branch, and periosteal branch and muscular branch. These are all the branches of typical intercostal nerve. And we come across a point that piercing the muscles. Now this is the muscle structures. After piercing it forms into anterior and posterior divisions. So here is the branches. There are 5 branches: rami commitans, muscular branches, collateral branch, lateral cutaneous part, anterior cutaneous branch. Rami commitans. Each nerve communicates with the corresponding thoracic ganglion by white and grey rami communicants. In muscular branch, these are all small slender branch from the nerve which supplies intercostal muscles and serratus posterior and superior. Serratus posterior and superior. Then collateral branch. It supplies intercostal muscles, parietal pleura and periosteum of the ribs. Lateral cutaneous part. It arises from posterior part of the intercostal space. It divides into anterior and posterior branches to supply the skin on lateral thoracic wall. Anterior cutaneous branch. It divides into medial and lateral branches and supplies the skin on front of the thoracic wall. These are all about the branches, and we move on to applied aspect. So intercostal neuralgia is the applied aspect. It is caused by injury and inflammation to intercostal nerves. It reduces the motor functions around the affected area. Thank you.